am a radiation oncologist, and I work as a radiation oncologist in my career. In 2019, at that time, she was a student doctor, Eliana Fine, and I met actually through Instagram, work of support for current and future from women doctors. And I always say, put a bunch of busy, opinionated women in a WhatsApp group together, and pretty much immediately we'll start thinking about how we need to fix the world and change the world and, do all the things. And that's happened. And we immediately started to think about ways that we can offer health education to the FROM community. And that's really the forward-facing part of our organization. We've grown significantly over the last years, and the education efforts that we have undertaken, probably many of your followers have seen or participated in some of our webinars, which focus on women's health, preventative health, teen health, mental health, really anything related to health. We write articles, we print health education specifically geared towards the Orthodox Jewish community.
Amy, I have to tell you that somebody reached out to us in our DMs after reading Hindy's story, and she was someone who was actually considering going into medicine and wanted to have a network, literally was asking for JOMA. Like she wanted to know how could she meet Hindy or talk to Hindy or talk to someone who could support her in her journey. And we're like, hey, check out the website. This exists. Like, this is for you. It's so amazing.
So, I don't really normally share about, I don't always share the, network of support part of our organization because, for those women that are not interested in pursuing it can seem very abstract and sometimes to some people even unnecessary. Like, well, what do you need a network of support for? Why can't you just go to your pre-med advisor? But if your daughter, wants to go to medical school, why you need JOMA. And the truth is that it's hard to go into medical school really from wherever you're from, and it's even harder as an Orthodox woman. And our members, we have over 300 members, are so happy to help the next generation of young women pursue, their passions and help them get into medical school, help them get through their training, support each other, as attendings at all different stages. So yes, if anyone here is interested in becoming a physician, definitely, of course, you can always message me anytime, but also follow Joma_org and check www.joma.org. Join Pre-Med Society, which is a WhatsApp chat. We have actually right now we're trainings and interview sessions. So there's just so
awesome, amazing. So Hindy, are you part of
I'll
JOMA?
say also that JOMA. Yes.
Sorry, you cut out.
And I would say that also. Oh, can you guys hear? Sorry. JOMA.
Yeah, it should be fine. Yeah, go ahead.
JOMA is totally, I commend Mimi and all the others who really started it. JOMA is literally the organization that all of us wish we had, a couple of decades ago when we were sort of starting out. And it is also primary places to which I refer women, young women, students or women who are already in, college or med school to be able to network and to find support for each other. I just found out that JOMA has a cooking WhatsApp, which sounds sort of, funny, but brilliant. Like working women who just need kind of quick and easy places to find each other and help each other. Like, yeah, share that recipe with me, please. Great. I love it.
That's awesome. A lot of crock.
My entire Rosh Hashanah menu is from this WhatsApp group. And by the way, I love.
So nice.
Yeah. There's a little bit of a delay here. I apologize.
Awesome. No, it's never perfect. Okay, so I'd love to hear from both of you, and Hindy maybe as someone who is in the thick of, the field, and certainly Mimi as someone who's, really guiding women in medicine. What are you seeing about the prevalence of Orthodox women, Orthodox young women becoming doctors? So Hindi, what do you see? I know you do a lot of mentorship as well.
You know what? I think that we're seeing more than we used to. You know, when I was in when I was in high school, I was definitely told not to do it by a lot of people around in the community. You know, it's too hard.
Huh. Why was that too hard?
I think I think the feeling generally was it's too hard, it's too long, you're going to give up too much as a woman. Like, will you be able to get married? Will you be able to have a family?
Wow.
Will you be able to get through, stay connected to Orthodox Judaism? You know, a lot of concerns. Also just, you know, being out in sort of very professional world. I think now, because of Joma and other you know, women out there that are, it's a little bit more prevalent and a few more role models out there. I think it's become a little bit more accepted. You know, I still think there's room for growth. It is a bit more accepted. I think that men accept it more and are happy to have a woman as a wife who is a physician. I think the community really relies on having from doctors or Orthodox doctors who understand both worlds and can be able to provide guidance, understanding the Jewish and the Orthodox lens. And I think that, you know, the whole concept about now. So, you know, doing it in medicine is a little different, doing it in a different field, but that idea of having a work-life balance is very standard. So I think it's a little more common and a little bit less stigmatizing. So I'm very hopeful. Want it, and women who love it will go for it, and women who want something else will choose what they're really good at.
Right. And I mean, if we can do any part, you know, and destigmatizing, you know, for women going into medicine, just by showing you, for example, Hindi, on the account, you know, as an example and as a role model, like, you know, you're going to have, you mentioned there are corners that you're going to have to cut, you know, and they're going to have to drop some balls, but the support system that you have gets you through it. And I think that is so key, is to show people examples of women who actually have navigated this path. And what young women are sort of standing on the shoulders of giants as they embark. And then certainly to have Joma holding their hands. So Mimi, let's hear your perspective on what you're seeing.
Let me just say that
from women, Orthodox women joining the medical field.
Yeah, let me just say
go ahead.
that we all need Hindi as a role model, all of us in the world, including myself. So thank you, Hindi, for being who you are. And, you know, interesting because my mother is actually a physician. My mother is a first-generation American, daughter of Holocaust survivors. And, you know, my mother says, like, she didn't really think about it. Her father said, "You're going to medical school." And she said, "Okay," and did it. And at the time that my mom went to medical school in the early 1980s, only a quarter of medical students were women. And now, and it's been this way for a couple of years already, a little more than 50% of medical students are women.
Yeah.
So the landscape of medicine has changed, and yet I have conversations basically once a week or more with young women today from our community who have the same questions that I had, you know, almost 20 years ago when I was pre-med. You know, those worries about, exactly like Hindi said, those worries about, will I be able to have a family? Will I be able to succeed? All those questions, I hear them literally exact same questions. So, you know, it leads me to think, you know, those questions might not ever go away. But I really do believe strongly that role models, not just abstract role models, but engaged role models, you know, we don't use that often.
Yeah.
But one of my mentors, Dr. Reshma, you know, taught me that word. And, you know, a sponsor is a mentor who's visible and chooses to champion their mentee. That's something that we all do for each other at Joma. You know, if you're a young woman applying to medical school, you're enough. You know, you're amazing. I am happy to write you a letter of recommendation. I'm happy to make phone calls for you, network for you, and we all do this for each other every day. So I think, the culture of guilt, the culture of you can't be it all, if you're a woman, not if you're a man, but if you're a woman, I think that's so, so strong that, as from women, we're just not immune to it. So we just have to realize it's always going to be there, and we have to just literally attack it head on. Like, yeah, of course, you can't be everything. Right. What does everything mean? Are you going to be president and CEO and, no one can be everything. It's just not, you can't go be an astronaut and, be a dancer at the same time. Like, you just have to pick what you want to do.
Right.
Do you mind if
I have to ask you both your opinion on this? So, oh yeah, please.
Sorry. I would say, I want to just add, and I just want to add that I think the other aspect is that it's really helpful to have women in medicine, not just as, okay, women can do it, so we can do it. But if you flip around what the community needs, we're providing a service for our community. Alex, honestly, it's really helpful to have journalists who are from, and thank you for doing what you do, because we need people who are authoring articles and being creative directors, who understand. And I think our community needs women doctors. I mean, I happen to be in the field of women that sort of more directly touching, but radiation oncology, pediatrics, GI, everything. There are very specific needs of the Jewish community, and women can provide a perspective and help. I get phone calls from Rebbeim all the time, and I love that. I love that part of it, that I can provide a perspective that sort of another obstetrician perhaps can't, because I'm a way that maybe somebody else couldn't.
I 100% agree with you. And you know what else? This is something that is very recognized within the medical community itself. There's actually a term for it. It's called underrepresented groups in medicine. And we can argue, and some of us at JOMA have actually published on this topic even before we started JOMA. You could definitely say that from women are underrepresented in medicine. A very specific term. It means groups that have fewer of themselves in medicine, right? And why is it important? It's important for Black communities, Latino communities, Asian, whatever community you look at, it's important to have sort of representatives in the healthcare field. And we know that outcomes are better. And like Hindi said, we see it every day. I treat all different kinds of patients, and I know that my from patients sort of appreciate me the most because I get them. I'm one of them, and that's why I think also why JOMA, our education platforms are growing so rapidly, because there's a tremendous need, but even more so, this is a tremendous interest from the community members to learn from women who have expertise and are able to give back. That's something that only we can offer. So like Hindy's saying, we're providing a community service that we exchange or replace with anyone else.
Amazing. And you add so much value, like Hindy was saying, to the Orthodox community. I mean, to have a female obstetrician to consult with rabbis who have questions, in terms of, halachic Jewish law issues that are related to that. I mean, it's invaluable. I do have to ask you, Europeans, I'm married to a doctor, and my husband went to medical school once we already were married. So I have like a very interesting perspective as sort of like the supporter of the process. And, he wore his yarmulke to medical school. He was a very obviously religious person. And he said because he was overtly religious, people would come and talk to him and sort of consult with him. And he said there were a number of, he went to University of Maryland, and you're right about the statistics. It was 50% female. And there were young mothers who were non-Jewish mothers who were in medical school. And he said he remembers one conversation where this young woman said, I always learned that as a woman, I could have it all, but I can't. Like, she was struggling in medical school. I'm so curious if you believe in general, is that accurate? So Hindi, what are your thoughts about that?
I would say you can have it all. You have to define what all means, right? You can't have it all at the same time. and you can't have it all perfectly at every moment, but can you have it all in the sense of, can you be a really good mother, and can you be a really good doctor, and can you be a really good friend and a really good wife? I do think so. Yes. I think if you put certain support things in place, remind yourself of what your priorities are, then you can have it all. You may not be able to be the perfect wife and the perfect mom and the perfect doctor and the perfect everything exactly the same moment. We're all going to have our times when we're like, I wish I had gone differently, right? We're all going to have that. And we're also going to have times when we realize, okay, because I'm doing this, I'm therefore not doing something else, right? As I actually just mentioned in the post the other day, like, I'm like embarrassed, like nobody could walk in my house. It's like a minefield, 9 boys make a lot.
We love that about you. Thank you. So validating.
Minefield, literally like a minefield, like something exploded. But I'm coming to on Instagram from back to school night. I ducked into a classroom because being at back to school night is really important to me. And being on Instagram tonight to be able to talk about it was really important to me. So look, I made, so yes.
Awesome. That's just really encapsulates your whole post. So I love that. And we were going to try to end at 9:30 so you can go back to school night. Okay. Hindi, what are your thoughts about that feeling that women may feel that like, no, I was duped. We can't have it all. It's too hard.
I'm soaking it all in. I'm just loving everything you're saying, Hindi. I totally agree. I feel like our brains have the same sentences, mottos. So this is just awesome. I want you to be a friend and move to New York. I'm just going to add one thing because I really do agree with everything you said. I find a helpful tool specifically to remind myself of prioritizing and not having it all or wanting it all at the same time, because that doesn't even make any sense, is to sort of list all the things I don't do and won't do and don't want to do. So, and Hindi, you did this in your post, these are things that what you said is you don't like to do or are not good at, or I forget how you explained it, but I do the same thing. For many years, I said to myself, okay, I'm not a person who goes out for lunch with my friends, and I'm okay with that. I don't do that. So every time it came up, it wasn't like a thing. It was just I don't do that, Now I work 3 days a week and I'm 24/7. So I do, go for lunch with my friends, but I don't do other things right? So it's so important to really be specific with yourself. I don't do these things and I do other things, and being okay with that and reminding yourself. And I also just want to point out that I'm here as a representative of JOMA. There are hundreds of us. Any one of our members could be here speaking in my place. One is an absolute rock star of a person, just the top of their field, getting stuff done, taking care of their families, giving back to their communities. I don't know how they do it. They're just absolutely amazing. So I don't want anyone to think here that it's just me and Hindi. Hindi is super amazing. And also they do this every single night and bring you a different person. There's just so many women that are doing this. So I don't want anyone to think just us. There's so many of us.
Amazing. Okay, so let's talk about typical challenges that Orthodox women face in medicine. And that could be in their schooling. It could be once they actually are working with schedules. And is this unique to Orthodox women, or is this in general, challenges that women face in the medical career? Mimi, you can go first.
Yeah, I'll be quick. I think that aside from the issues that we discussed, and work-life sway, obviously young women in medicine who are married, in the Orthodox community, most of us have children younger. That's a major challenge because there's basically zero support in medical school. It's also very expensive to get help, so that's a major challenge. And then the challenge of keeping Shabbos and Yontif, it really depends on the medical school that you're in. Where I went to medical school, they were totally not supportive and threatened to fail us if we missed things, because of Yontif. Other medical schools are totally fine, no problem. So that's actually where the network is really, really helpful. Asking people who are ahead of you and saying, like, how did you navigate this? What's the best way to get permission? And I'm not sure it's unique to medicine, probably other fields also. It's just, there's just a lot of time commitment, so it can be difficult. And I'm sure, Alex, you have, great horror stories as well. It's just one of those things, but you get through it.
Yeah. Yeah. I am just in awe of like couples where both of them are doctors. I'm like, I don't know how you do that. Because like, I'm really trying to hold the fort down over here because I know my husband is a really, really demanding schedule. He's an internist. Okay, Hinsey, what challenges, tell us the challenges you face as an Orthodox woman in medicine.
I think the mom guilt's a real one, sort of like an existential type one. And I think, as you mentioned, there are a number of halachic ones like Jewish law. What do you wear, right? As an example, everyone knows people wear scrubs in the hospital, but scrubs are low cut and scrubs are pants and scrubs are short sleeves. So those are factors that as a Orthodox woman, I don't do. So now what do you do? And what do you do when you go to the operating room where the dress is like really even more navigating? I personally actually have custom made skirts. So I do not wear pants. I wear custom made scrub skirts. And I wear, something under my scrubs, but for the operating room, I don't wear something too long under the sleeves because it's not sterile. But just sort of things that men don't, I think there's some things that Orthodox men and women think about equally, like kosher, right? Unless you happen to be at a Jewish hospital, there's never kosher food anywhere. So navigate kosher and being always the one person who's different in the room. But as a woman, kosher, as an Orthodox woman, dress is a big one. Sleeping arrangements when you're on call. I'm in a field that's 24/7. When you're on call at night and there is a bunk bed and the other person on call is a man, that's not something that I feel comfortable sleeping in another room with another man who's not my family. So, then what do you do? And I think, I don't know if I mentioned on the post or not, but when that happened to me, I just pulled a chair and slept, on 2 chairs in a lunchroom. Like those are kind of some of the things that you have to do. So I think that, you have to, it's really about staying passionate with what you love, staying true to your beliefs and realizing that, as long as you're sincere and passionate, stuff will work out, with help from friends and mentors and family, but, always keeping true to your beliefs. If your beliefs are X, Y,
I love that.
Yeah.
I love it. And Hinsey, I love that came across so strongly in your post, and also how you always see it in consulting with rabbis to like help you find the way to do things according to your comfort level and according to Jewish law. It's really admirable. We're going to close with a final question. Mimi, you can go first. What is your number one piece of advice for young women, young Orthodox and religious women who are considering a career in medicine?
I'm going to have to say 2 things, so I'm apologizing in advance. Number one is
No problem. You're allowed. I'll give you 2. You're ahead, Joe.
If you want to be a doctor, go for it. If you can imagine doing anything else, don't do it. Like, really, it's a very big commitment. You should not pursue a career in medicine to become a physician unless it's literally the only thing you want to do. But if it's the only thing you want to do, you will do it and you will be so happy. And then the second piece of advice is, don't ever make decisions during a stressful time period. And those stressful time periods are constant. It's up and down during your medical training. It's also up and down with kids and with family and with spouses and with everything else. The worst thing to do is to make a decision during a moment of stress or a period of stress. Wait for it to end and then make your decision. If I would have done that, I would have quit being a doctor 100 times. And thank God for support systems. Thank God for support systems who remind you, your housekeeper, don't worry, you'll find a new one. Don't quit. So that's the best advice I could give.
No, it's
Mimi,
great advice in general. Like when you're stressed, don't make life decisions. Doesn't matter what career you're in. Yeah, Hinzi, what would you say?
Mimi mentioned before that we're new blood sisters, and I literally think we are now. Not joking, you said,
Oh,
but I say all the time to people when they ask me. I mean, word for word, you said it. If you want to be a doctor, be it. Go for it. Do not give it up. You know, it's your passion, and I think there are so many. Sadly, we're told not to, and they turn back at age 30, 40, 50, 60, still saying, "I wish I were a doctor." But if there's
yeah.
anything else, fully do that, because medicine's a long
If there's
road.
anything else, what? You broke up.
If anything else that you love to do equally, do that, because medicine is a long road during a lot of very prime years. So love medicine,
Right.
and you can't imagine anything else, do it. But do that.
That's awesome. And I just would like to give a voice to all the other many fields and careers in healthcare. Whereas, like, if there's a young woman who, for whatever reason, is concerned about medical school and the long road and the hours, there is nursing, there is OT, there is PT, there are other medical fields that if they have a love for medicine and healing, right? There's other avenues that they can
Absolutely.
explore, correct?
And they're great fields.
I think that's important. Yeah. But guys, keep up the amazing work and being role models, doing the amazing professional work that you're doing already in your careers, but also being outwards focused and supporting other women in their journeys is just, I just want to thank you so much for all the incredible work you're doing. And thank you so much for being on this live to share your wisdom with us tonight.
Alex, I would, snap that at you. Thank you for being a role model to all these women and people out there, from journalists and world, to really highlight Faces of Orthodoxy.
Thank
I think
you.
it's phenomenal. I do not.
Thank you.
Very admirable.
Well, I think that's a wonderful ending message, is we all have our different talents and abilities, and we should not feel at all intimidated by other people shining. Let everybody shine in their own way. I have zero interest in medicine. I just want to say that. You know, like we all have our own strengths that God gave us, and we need to listen to our own inner voices and pursue what we need to do. All right. Well,
Thank you so much. Have a good night.
Thanks for your time, and wishing you both a Shana New Year.
Bye-bye.
Thank you.